Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us again today. PRN Newswire, in a press release, claims that nearly 2/3 of baby boomer nurses are considering retirement, even as RN demand rises rapidly. Basically, a large-scale exodus of our nurses, and our nurses being basically the front line when it comes to taking care of patients, administering medications. Really, many nurses are more knowledgeable than some of the doctors that they assist. Our guest in studio today is Marcia Faller, PhD and RN, also Chief Clinical Officer for AMN Healthcare. And throughout her tenure with AMN, she's championed the development of consistent quality standards for credentialing and competency evaluation of healthcare professionals, setting her company AMN apart in the industry and giving it a name synonymous with quality healthcare professionals. How are you doing today, Marcia?
I'm great, Neal. Thank you.
Could you tell us a little bit about the survey and why it's so important?
Sure, Neal. The survey is a survey that AMN Healthcare puts out every other year and it's the fourth survey that we've done. The report based on the survey is titled the 2015 Survey of Registered Nurses, Viewpoints on Retirement, Education, and Emerging Roles. And it provides nurses' views on retirement, education, quality of care, and concerns about the nursing profession. The survey analyzed responses from nearly 9,000 RNs across the country and projects some major changes in the near future, including a timetable and dimensions for a wave of retirements by baby boomer nurses. The retirement surge, while having been long predicted coming out of the Great Recession, the survey is now showing that it's really about to hit and preparing it, hopefully, is a signal to prepare us to make some changes so that we're ready for it.
Now, the Affordable Care Act put a huge strain on the legislature and also on patients, most importantly. When it comes to nurses dealing with the Affordable Care Act, I mean, having health care is the law. More people are going to have health care. More people are going to be going to their health care providers. Are any of these nurses considering foregoing retirement, even though they are in the baby boomer age? And is it age alone that is a factor when it comes to considering retirement?
So I do believe that, what we're looking at and what the survey found is that predominantly age is the reason that these nurses are retiring. There are other reasons that nurses are telling us about in terms of dissatisfaction that is making them want to make a move in their career, either retiring or moving to part-time, and that applies to the younger nurses as well. So some of those reasons are, most all of them, honestly, are workplace related, and we see that in other research reports as well. So the ones that were cited in the survey were inadequate pay. So the nurses believing that they're just not receiving compensation that's adequate enough to cover for the work that they do. With the increasing, as you mentioned, the legislation and other things coming along, nurses are more and more, they're the frontline people taking care of patients and really have a huge impact on patient satisfaction. As you know, patient satisfaction scores are key, becoming more and more important over the years to reimbursements. So, supplying adequate pay and compensation to the level that nurses believe they are being adequately compensated is very important. Another area they talk about is the workload just being too high, that the staffing ratios are too high and they don't have the time to care adequately for their patients. Additionally, staffing shortages, a little bit tied to the workload being too high, but just not having enough nurses to staff a particular unit is what's putting the workload, into that range that's unmanageable. They also cited just working too many hours and scheduling just being difficult. As you know, hospitals run on a 24/7, 365 basis.
Absolutely,
and so working nights and weekends and holidays is part of that job over the length of a career. And then finally, they mentioned just troubles with management and administration. Due to the nursing shortage, many of the nurses put in leadership positions don't have a lot of experience either in leadership. And so that can be a challenge in terms of workplace satisfaction of nurses. And really we're finding is one of the reasons why nurses are potentially wanting to leave the career.
Are you finding that older nurses are giving the younger new nurses advice and help, knowing that they themselves are ready to leave? Is that something that you're seeing? How much are the baby boomer nurses participating in or even willing in educating the younger nurses in order to take over their important role?
Yeah, that's a really great question, Neal. Nursing has been known for being really tough on the newbies. Mm-hmm. So I don't think that the profession is actually, and the survey really I don't have any results to quote you from the survey, but it's something that, I think nursing administrators across the country are working on, is getting those older nurses, those baby boomer nurses, into positions where they can be mentors during the end of their career, to be able to get those younger nurses up to speed and deliver and just transfer that knowledge that's so important that those new nurses have. Nursing has not been known for that in the past, but it's recognized that we really have to shift that mentality in the future.
I'd like to ask you about AMN specifically and how AMN is helping to stem or at least address this coming lack of nurses. You're involved in continuing education of those that you represent. Are you giving your clients information or advice on how to become more attractive to this new workforce as the old workforce leaves for various reasons?
Yes, absolutely, in a couple of ways. First of all, you may know that we have our workforce summit going on this week in Nashville, and this is an area where we actually are delivering. One of the speakers that we have delivering a talk at this conference is talking about the generations in the workplace and healthcare and how to address the particular needs. So absolutely, we want to give our clients more information to be able to help them manage in that area. The other area that we help our clients out is through our Center for the Advancement of Healthcare Professionals, which we call the Center. But we deliver customized training programs to help healthcare providers train and sustain the workforce that they'll need to adequately care for patients in the future. The Center actually works with healthcare clients to identify a shortage in a specific specialty or segment, and then puts together a curriculum and program to successfully train nurses in large numbers. Innovative programs like the Center fulfill a need in terms of creating new supply that you just may not be able to find elsewhere. And we certainly hope to help our clients be able to do that. And this is where the survey itself tells us that that younger group of nurses is really interested in this sort of training program.
Now, it's all about the interweb machine. And give us a website that our listeners can visit to find out more information about AMN and possibly view this survey that gives us information for themselves.
Sure, Neal. That website is www.amnhealthcare.com, and the survey itself can be downloaded at that website.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio speaking with Marcia Faller, RN, PhD, Chief Clinical Officer for AMN Healthcare. Earned a Bachelor of Science in Nursing from the University of Arizona, as well as a Master of Science in Nursing and Doctorate in Nursing from the University of San Diego. Also on the Board of Directors of the Alliance for Ethical International Recruitment Practices, and on the Joint Commission Advisory Board for the Healthcare Staffing Services Certification Program. And she's been here with us today talking about not only the fact that nearly 2/3 of baby boomer age nurses are considering retirement, but also talking about how her company is poised to provide staffing solutions to stem the tide of this exodus. It's been great talking with you today, Dr. Faller.
Thank you so much, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.